Welcome to the deep dive. Today, we're looking into something pretty important for our dogs and cats, specifically hypoalbuminemia.
That's right. Yeah, we'll be talking about what it is, why it happens, the signs to look for, and how vets figure it out and treat it.
Right. The aim is really to give you the essentials without drowning you in super technical terms.
Exactly. We want it to be clear, make sense.
And we're basing this on excerpts from Veterinary Hypoalbuminemia, Diagnosis and Treatment. So, our mission for you, the listener, is to get a good handle on this condition. Okay, let's dive in. First off, what is hypoalbuminemia?
Simply put, it just means that a blood test shows the albumin level is lower than the normal range for a dog or cat.
Albumin. Okay, why is that important? What does albumin actually do?
Oh, that's a really key question. So albumin is this protein, and it's only made by the liver.
Only the liver.
Yep. Think of it as a major player in the bloodstream. One of its biggest jobs is keeping the right amount of fluid inside the blood vessels. It accounts for like 75 to 80% of what's called plasma colloid oncotic pressure.
Plasma colloid oncotic pressure. Okay, that sounds technical but important. It's about keeping fluid in, you said.
Exactly. It's like a sponge effect, holding water inside the vessels. So when albumin levels get low, particularly below, say, 1.5 grams per deciliter.
That sounds quite low.
It is. When it gets that low, there aren't enough sponges, and fluid can start to leak out.
Leak out where?
Into the surrounding tissues, causing swelling, that's edema, or into body cavities, like the chest or abdomen, which we call effusions.
Okay, so really low levels mean leakage. What if it's low but not that low, maybe between 1.5 and 2.5? Do you always see swelling then?
Not necessarily. Those levels aren't great, obviously, but they might not cause visible edema or effusions all on their own. Often it's, a combination of things.
Like,
Well, if there's also increased pressure pushing fluid out of the vessels, maybe from heart issues, or if the vessel walls themselves are leaky due to inflammation, then even that moderately low albumin can be enough to tip the scales.
right, it's like the final straw sometimes. So this fluid leakage, which body systems feel the effects most?
You tend to see the impact most clearly in the cardiovascular and respiratory systems. We can get these transodative effusions, that's fluid that's mostly water, low in protein building up.
Where does that fluid build up?
It can be in the chest cavity, that's pleural effusion, making breathing difficult. Or in the abdomen sites, you might also see swelling in the legs, peripheral edema, or even fluid in the lungs themselves, pulmonary edema.
Wow, okay, so it can show up in a few different ways.
Mhm.
Is this condition, hypoalbuminemia, something common or more of a rare thing?
Well, that's an interesting point. It's usually not the primary disease itself. It's more often a sign or consequence of something else going on.
Ah, okay, so it's like a signal flare.
Exactly, a red flag pointing towards an underlying problem.
So let's talk about those underlying problems. What are the main reasons a pet might end up with low albumin?
We can sort of group them. First, there's decreased production by the liver.
Makes sense, since the liver makes it.
Right. So chronic liver issues, think chronic hepatitis, cirrhosis, that kind of thing. Also, some congenital problems like portosystemic shunts, especially in dogs, where blood bypasses the liver.
Okay.
And, of course, if the pet isn't getting enough protein in their diet or if they can't absorb nutrients properly from their food, malnutrition or malabsorption.
Right, not enough building blocks or the factory isn't working right. What's another major cause?
The second big category is losing albumin from the body. Like, it's being made okay, but it's getting lost somewhere.
How does that happen?
A major route is through the kidneys. This is called protein-losing nephropathy, or PLN. The kidneys' filters get damaged and leaky, and albumin escapes into the urine.
What kind of kidney diseases cause that?
Things like amyloidosis or glomerulonephritis, they damage those tiny filters.
Leaky kidneys, got it. Where else can albumin be lost?
The gut is another big one. Protein-losing enteropathy, or PLE.
PLE.
Okay. This can happen with conditions like lymphangiectasia, where lymphatic vessels in the gut wall are leaky, or certain cancers like lymphoma, severe inflammatory bowel disease, even some nasty fungal infections like histo or pythium.
Wow, lots of potential gut issues.
Definitely. And you can also lose albumin through, say, really weeping skin lesions, chronic bleeding, especially into the gut, or even if large amounts of fluid are repeatedly drained from the chest or abdomen.
Okay, so loss through kidneys, gut, skin, bleeding. Any other categories?
There's a third one we call sequestration.
Sequestration, what's that?
It means the albumin is still in the body, but it's moved out of the bloodstream and into other places, like large pockets of inflammatory fluid.
Oh, I see.
So for instance, with pancreatitis or big infections in the abdomen or chest cavity, albumin can shift into that inflammatory fluid. Also, certain diseases affecting the blood vessels themselves, vasculopathies, can cause albumin to leak out and get sequestered.
Okay. And are there any, like, miscellaneous causes, things that don't quite fit those categories?
Yeah, a few. Sometimes the body might dial down albumin production if other protein levels, like globulins, are really high, or as part of a general response to chronic illness or inflammation, what we call a negative acute phase response. Also, severe malnutrition leading to a negative nitrogen balance, where the body's breaking down more protein than it's building, that can contribute. And even Addison's disease, hypoadrenocorticism, can sometimes be linked to albumin loss.
That is a lot of potential causes. Does this mean certain pets are more at risk?
Absolutely. I mean, logically, any pet with a known disease of the liver, kidneys, or intestines is at higher risk. Same for diseases affecting blood vessels. And conditions leading to that negative nitrogen balance or just poor nutrition definitely raise the risk profile.
Okay. So moving on to spotting it, how might an owner or a vet even suspect hypoalbuminemia? What are the signs?
Well, often the signs you actually see are related to the primary disease, whatever is causing the low albumin.
Right, the root cause.
Exactly. But the low albumin itself does have effects. Like, it can change how drugs bind to proteins in the blood, maybe making some drugs more potent. It messes with fluid balance, as we said. It can influence acid-base status and even played a role in maintaining blood pressure.
So the effects are quite broad, even if the signs might point to the original problem. What about the pet's history? Any clues there?
Yeah, the history can be revealing, but again, it often points to the underlying cause. But like I mentioned with the drugs, maybe a history of being unusually sensitive to certain medications could be a subtle pointer towards low albumin affecting drug binding. It's something a vet might consider in the whole picture.
That drug sensitivity angle is interesting. What about the physical exam? What might a vet find?
Again, very much tied to the primary disease. But if the hypoalbuminemia is severe, like below that 1.5 GDL mark, the vet might find that generalized swelling all over, anasarca, or they might detect fluid in the abdomen or chest just by listening or feeling. That's because those fluid balancing forces, the Starling forces, are really disrupted.
So a really puffy pet definitely raises that suspicion. When a vet thinks low albumin might be involved, what other conditions are they thinking about? What are the differentials?
Top of the list would be severe liver disease, PLE, PLN. Also those extensive skin lesions losing protein, significant blood loss, severe malnutrition. And it's worth remembering that sometimes really aggressive fluid therapy, particularly with synthetic colloids, can dilute the albumin or make existing low levels worse, at least temporarily.
Okay, lots to rule out. So how do you actually confirm it and figure out the cause? What tests are run?
A CBC, a complete blood count, is usually standard. It might show anemia if there's blood loss, or sometimes odd red blood cell changes with liver disease. Gives clues.
And the chemistry panel, I assume that's crucial.
Oh, absolutely central. The key finding, of course, is the low albumin itself. But you look at other things too. Globulins, are they high, suggesting chronic inflammation or liver issues? Are they low? Maybe suggesting loss alongside albumin, like in some PLE cases. Or normal, like often seen in PLN. Cholesterol is another one. It can be low with liver failure, severe PLE, Addison's, but high with PLN or pancreatitis. Liver enzymes, ALT, ALP, are they up? Bilirubin, kidney values, BUN, and creatinine. Electrolytes, low sodium, high potassium might point towards Addison's. And importantly, low total protein can make the calcium level look falsely low. We have to correct for that.
Wow, you get a ton of information there. What about urine tests?
Urinalysis is super important, essential really. You need to check for protein loss through the kidneys, PLN, and rule out blood loss in the urine. Getting a clean sample, usually by cystocentesis, a needle into the bladder is best.
Right, to avoid contamination.
Exactly. If there's protein in the urine dipstick, you usually need a specific test called the urine protein, creatinine ratio, the UP-UCR. If that's persistently high, especially over 3.0, that strongly points to significant kidney protein loss like PLN. You also need to look at the urine sediment under the microscope to make sure infection or blood isn't the main reason for the protein.
And microalbuminuria testing, is that useful?
Generally, no. Testing for those tiny amounts of albumin isn't really considered helpful for figuring out the cause of already established hypoalbuminemia.
Okay, so blood and urine are key. Any other lab tests that help narrow it down?
Yeah, sometimes. Bile acids tests can help assess liver function. They're usually high in significant liver disease, though they can sometimes be falsely low in PLE. If there's fluid buildup, analyzing a sample of that effusion fluid is very useful. Is it a transudate, low protein, low cells? That points strongly to low albumin being the main driver.
Makes sense.
We might also measure specific clotting factors like antithrombin or AT and protein C. If they're low, it suggests a higher risk of blood clots, which we worry about particularly with PLN, but also sometimes with PLE and liver failure.
What about looking inside? Imaging? X-rays, ultrasound?
Definitely. Chest x-rays can show pleural effusion or pulmonary edema. They might also show other things, big lymph nodes, heart changes. Abdominal x-rays might show ascites, changes in liver size, maybe hints of pancreatitis.
An ultrasound?
Abdominal ultrasound is often really helpful. It gives a much better look at the organs, liver texture and size, intestinal wall thickness, masses, fluid, lymph nodes, checks blood flow. It can pick up subtle changes suggestive of PLE, liver disease, or other issues.
So imaging gives a good visual. What if you need more definite answers? Biopsies.
Yes, sometimes biopsies are the only way to get a specific diagnosis. A liver biopsy, after checking clotting times, of course, can tell you exactly what kind of liver disease is present. Kidney biopsy is often needed to figure out the specific cause of PLN. And intestinal biopsies, either via endoscopy or surgery, are frequently the key to diagnosing the cause of PLE.
You have to be careful with surgery if albumin is very low, though, right?
Yeah, that's a consideration. Very low albumin can impair healing, especially after abdominal surgery.
Okay, so we've worked through the diagnosis. Let's talk treatment. What's the main goal?
The number one goal is always treat the underlying cause. Whatever is making the albumin low, that's what you need to target. If it's PLE, you treat the gut disease. If it's PLN, you manage the kidney disease.
Right. Fix the root problem. What about supportive care in the meantime?
Absolutely vital. If there's pleural effusion making breathing hard, you might need to drain it, thoracentesis. Sometimes a temporary chest tube is needed. Good nursing care is important too, like gentle massage or movement to help mobilize peripheral edema, the swelling in the limbs.
Does diet play a role in management?
Oh, for sure. You want to make sure the pet gets enough calories and protein to help the liver make albumin, assuming the liver can make it. We call this aiming for positive energy and nitrogen balance.
But are there exceptions?
Yes. If a pet with liver disease has hepatic encephalopathy, neurological signs from toxin buildup protein might need to be restricted carefully. If there's a lot of edema or effusion, sodium restriction is often recommended. And for PLE caused by lymphangiectasia, a special ultra-low-fat diet is usually critical.
And you mentioned surgery before. Any other considerations for pets with low albumin needing procedures?
Yeah, besides the healing issue, low albumin can affect how anesthetic drugs are distributed and metabolized. It can also increase the risk of fluid shifting into body cavities during or after surgery. So anesthesiologists need to be aware and plan accordingly.
What about medications? Are there drugs used specifically for the low albumin, or is it all about the primary disease and support?
Mostly it's treating the primary disease, but some meds help manage the consequences of low albumin or the underlying issue. Glucocorticoids like prednisone are used for certain types of chronic hepatitis or PLE. Diuretics, furosemide, spironolactone help get rid of excess fluid from effusions or edema. For pets at risk of blood clots, especially with PLN, we often use antithrombotic drugs like clopidogrel. And drugs like enalapril, ACE inhibitors, are standard for managing PLN in dogs.
Are there things to be careful with, meds or treatments to avoid?
Well, synthetic colloids, those artificial fluid expanders, need to be used very cautiously or sometimes avoided in pets with very leaky vessels or severe hypoalbuminemia, as they can worsen fluid overload.
Got it. Any other general precautions when treating these guys?
Definitely. You have to be careful with overall fluid therapy. Don't want to push too much fluid if the albumin is low and can't hold it in the vessels. Plasma or albumin transfusions might seem logical, but the benefit can be short-lived if the underlying loss is massive and ongoing. Plus, there are risks. Diuretic use needs careful monitoring to avoid dehydration or messing up electrolytes. And, as we touched on, drug dosing might need adjustment for highly protein-bound drugs because with less albumin to bind to, more free drug is available, potentially increasing side effects.
Right, that risk of inadvertent overdose. So clearly, close monitoring during treatment is essential. What does follow-up typically involve?
Frequent checks are key. Monitoring body weight sudden gains might mean fluid retention, checking vital signs, listening carefully to the lungs for any crackles suggesting fluid, tracking the albumin levels with repeat blood tests, monitoring blood pressure. If there was a sites measuring abdominal girth can help track progress. Sometimes central venous pressure is monitored, but carefully.
Is there anything that can be done to prevent hypoalbuminemia?
Since it's usually secondary, prevention really means managing the underlying disease as well. For instance, if glucocorticoids are needed for a condition, using the lowest effective dose for the minimum time needed is always a good goal to minimize potential side effects that could indirectly impact protein balance.
What are the big potential complications you worry about down the road?
Thromboembolism, blood clots, is a major one, especially with PLN. And hypovolemia, or low circulating blood volume, is another big concern. That can happen from dehydration, the underlying disease like Addison's or blood loss, or even over-aggressive diuretic use. Severe hypovolemia can lead to things like acute kidney injury.
And the big question, what's the prognosis? What's the outlook?
It honestly depends almost entirely on the underlying cause and how treatable that is. Some causes have a better prognosis than others. Getting that accurate diagnosis is just so critical.
Okay, so wrapping this up. The big takeaway seems to be that hypoalbuminemia is less a disease itself and more a really important clue. It tells us something serious is likely going on elsewhere in the body. Liver, kidneys, gut, somewhere, and finding that is the key.
Precisely. And it really highlights how interconnected everything is, doesn't it? A problem starting in the liver can end up causing fluid to build up in the lungs. It's
Yeah.
a delicate balance.
It really is. Which leads to a final thought. We talked about albumin-carrying fluid, but it also transports lots of other things. Hormones, drugs, calcium, bilirubin. So thinking beyond just the fluid balance, what other, maybe less obvious, ripple effects could really low albumin have on a pet's overall health or how they handle treatments? Something for you to chew on after our deep dive today. Thanks for joining us.